Hello everyone. Today we are going to see prosthetic cardiac valves. First, what is prosthetic cardiac valves? It is a natural heart valves have a very important role in our circulation. They ensure that blood flows only in one direction and they prevent any backward leakage. And these valves help the heart maintain good pumping efficiency and stable hemodynamics. Every day they open and close nearly 1 lakh times without failure, showing how efficient and reliable the natural valve structure is. And we need prosthetic cardiac valves mainly when natural valves become diseased. Conditions like stenosis or calcification stop the valve from opening and closing properly. Replacing them is clinically necessary to restore smooth blood flow and prevent further heart failure. Prosthetic valves significantly improve patient survival, reduce symptoms like breathlessness, and greatly enhance their overall quality of life. A healthy heart valve is thin, flexible, and ensure perfect closure during each heartbeat. It offers almost no resistance to blood flow, but in a diseased valve, the tissue becomes thickened and ridged, leading to incomplete closure. This causes improper blood circulation and increases the workload on the heart, eventually resulting in cardiac stress and progressive heart failure. Prosthetic cardiac valves are specially engineered devices that take over the function of natural valves by restoring proper blood flow. They must be highly durable because they undergo millions of cycles during a patient's lifetime. They also need to be biocompatible to avoid immune reactions and minimize thrombosis. Most importantly, they must maintain efficient hemodynamics by creating smooth and optimized blood flow patterns. These are three main categories of prosthetic valves. Mechanical valves come in forms like bileaflet, tilting disc, and caged ball, usually made from pyrolytic carbon and titanium. And then next one is bioprosthetic valves. It is created from porcine or bovine tissue. It mimics the natural structure. And the third type is tissue engineered valves, which are next generation designs made by growing living cells on biodegradable scaffolds for long-term adaptability. Mechanical valves are known for their exceptional durability and strength. They are often made from pyrolytic carbon, which is extremely strong and resistant to clot formation, along with the titanium frameworks and medical grade polymers. These valves can last more than 20 to 30 years, however, because they can still increase clotting risk. Patient must take lifelong anticoagulation medication. Bioprosthetic valves are made from porcine heart valves or bovine pericardium. Often treated to improve durability, they have excellent hemocompatibility and produce very natural blood flow patterns. Most patients do not require long-term anticoagulation with these valves. However, the major drawback is limited durability, usually lasting 10 to 20 years, and they are prone to calcification and structural degeneration over time. When designing a prosthetic valve, engineers must ensure strong mechanical integrity so the valve can resist fatigue. The material should minimize the platelet activation and prevent blood clot formation, and hemodynamic performance is crucial. The valve must maintain low pressure gradients and promote smooth and laminar flow. Biocompatibility is equally important to guarantee tissue acceptance and avoid immune reactions. And these are the types of prosthetic cardiac valves. It is mainly classified into two types. One is mechanical and tissue. The differences between two heart valves like mechanical and bioprosthetic. The mechanical valves are comparatively long durability and it have the high risk for thrombosis. The clot formation is high in the mechanical valves, and so that we need anticoagulation therapy for long-term purpose, and it has a high risk of bleeding. In opposite, the bioprosthetic valves are low risk for bleeding, and lifelong anticoagulation is not required, but the durability is comparatively less compared to mechanical valves. Prosthetic valves are used in multiple locations. Mainly, aortic replacement is the most common, while mitral valve replacement is more complex due to its anatomy. Recent advancements include 3D printed custom valves, nano coatings to improve biocompatibility, and polymer valves with adjustable properties. Less invasive procedures like TAVR and TMVR have valve replacement. It is used in especially for elderly and high risk patients. These are the references I used to make this PPT, and I hope this video is very clear and understandable. From this we can understand what is prosthetic cardiac valves and how the 5 different stages of the prosthetic cardiac valves and how it should be made like that. Thank you.